What is proton gene therapy?
Uh, the proton beam therapy is a radiation treatment that precisely delivers a beam of protons to disrupt and destroy tumor cells. Compared with traditional radiation, protons have unique properties that allow doctors to better target radiation to the size and shape of the tumor. The proton beam kills the tumor cells and spares more of the surrounding healthy tissue.
So, what kind of cancer patients could this be used for?
Um, it can be used for a variety of pediatric and adult cancers. In pediatric patients, it's especially important because of the tissues being very sensitive for these patients and will reduce and less harm to these normal tissues of children and really reduce the late effects associated with conventional radiation therapy.
And it looks like there's only one other place in the state that even has this, and it's all the way in Charlotte. So, what would the impact of having a facility like this to offer it to patients right here in the Triangle have?
Um, it will be enormously helpful for patients in the Triangle. Duke will have really the first proton unit in the Triangle area to allow access for, as I've mentioned, a variety of patients with different kinds of tumors, such as brain tumors, bone tumors, eye tumors, and again also the pediatric patients that I mentioned earlier.
How would something like this offer the treatment in a way that's better for a little kid?
Um, Protons are an important tool for treating children. Human tissues are particularly sensitive to radiation when they're growing, and radiation can impair bone and muscle growth in children. Because this therapy is less damaging to healthy tissues, it's now the go-to choice for the treatment of children who require radiation therapy. When patients and specifically children as well are cared for at a proton center, it's a team effort to make the patients and children as comfortable as possible during the process. The patient is placed on a couch and special devices are used to direct the radiation to the area in the body where this particular tumor is. The treatments are usually brief. They're only about 15 minutes at most, and the patients are leave in an outpatient setting with really minimal effects immediately after the radiation treatment.
Obviously, $50 million anonymous donation, was that something that you knew was going to come, or how did it feel to know that someone was willing to give that large chunk of money towards something like this?
We're incredibly grateful to the donor who contributed the $50 million. It's humbling, and we're really looking forward and really very eager to move forward with this proton program. This is the largest gift that Duke Health System has received in its history, and it will be well used and benefit the patients of North Carolina and the United States with this technology. It will be located very close to Duke Hospital, and it will be very, you know, in a sense, one of the important things is that it will be close to the medical center so that additional care can be easily done. The co-location is absolutely critical for having this level of expertise in this center.
How long have you been in the field of radiation and oncology work?
Um, I've I've been very fortunate. I've been in radiation oncology for approximately 40 years, and this type of technology has really an important advance. I've been at Duke for over 20 years, and the health system, the School of Medicine, physicians groups have been enormously supportive of this program, and we're all very excited moving forward with this.
When you think of 40 years ago, when you were starting to see patients and looking into this type of research to where we've come now with advancements in technology, skipping ahead another 40 years, what do you think is going to be possible?
Well, I think that there's so many advances in cancer care now, including immunotherapy, targeted treatments, uses of artificial intelligence in caring for patients. And I would anticipate that radiation therapy will become increasingly more sophisticated, delivering the radiation to the areas that need it, and avoiding the irradiation of normal tissue. I think also that the use of radiopharmaceuticals as a method of treatment will be more clearly defined as well over the next coming years.
How do you think patients are going to feel when they're able to have this access to this type of treatment?
I think the patients will welcome this access to this technology at Duke, as well as all the resources and technology and superb physicians and staff caring for patients, and the fact that it's going to be co-located with Duke University Hospital is really important. And it's a team effort caring for patients, and having these teams close together will be enormously helpful for all of these patients, and as well as children who are faced with very difficult malignancies often.